Assalamualaikum and very good morning to our lecturers, Madam Unku Munira. Before I start, let me introduce my name first. My name is Ahmad Nadir.
My name is Shazari Rizwan Kafli.
Assalamualaikum, Madam. My name is Amanina Alia binti Hassan Rijal.
Assalamualaikum, Madam. My name is Rafida.
Assalamualaikum, Madam Unku. I am Nurul Natasha binti Muhammad Rizwan.
Let's go to the introductions. What is risk management? Risk management is a systematic approach to identify, measure, and control risks that can be treated assets and earnings of oneself, a business of the organization. For example, the I can give is based on nowadays crisis that happen all over the world, which is coronavirus disease, or what we call another name is COVID-19. The World Travel and Tourism Council has warned that due to pandemic COVID-19, it could cut 50 million jobs worldwide in the travel and tourism industry. COVID-19 has brought the world to a standstill with the unparalleled and unforeseen impact in life, economies, societies, livelihood, and also loss of jobs. Next, we go through the scope, the main objective of the personal risk management. Is first, the important thing is to be free from COVID-19. Based on the information, they found that the COVID-19 has spread to almost the entire world. In addition, there are many scientists, doctors, and others have failed to find the appropriate vaccine against this COVID-19. So they must be to be more prepared to consider that circumstances and evaluate how much they are at the risk, and have to contingency plan when these bad things happen. Next is to personal matters. We cannot work because of a restriction of movement control. Thus, the unemployment rate will be drastically increased if the COVID-19 fails to solve it. As a result, the country of economy will be inflated or fall due to workers falling to work or carrying on a business activities. Next, we go through the scope of the risk management for the individual. I was mentioned in the report is 5 essential ethics in a standard precaution. Firstly, is effective hand hygiene, which is each individual should regularly wash his or her hands, must be followed by a proper technique. And next is a proper use what we call a personal protective equipment, or PPE. The PPE can reduce but does not eliminate the risk of infections. Thirdly is following the cleaning maintenance, which is all equipment and environment should be free of just body fluid, dust, and the other impurities. And fourth is ethic is disinfection and sterilization, or called a patient care equipment. This is to prevent a cross-infection. Medical equipment reasonable need to be cleaned and sterilized for making sure it is free of a microorganism or an spore, or this COVID-19 or the virus. And lastly, for the fifth ethics is a cook ethic. Cook ethics should be practiced regularly to prevent the spread the organisms that can cause a disease transmission. Next, I already mentioned that they have a statistic on this COVID-19 in the report, so you can see what the observation or point that can give is which is those age which is age 20 until 24 is the highest and get a 526 positive for the COVID-19, and age 25 until 39 is the second highest, which get a 495 positive COVID-19. And the third age is 56 until 59 will get a 453 positive for the COVID-19. So what's overall that can I conclude is this COVID-19 can be easily transmitted to humans, especially those with a low immune status or as a chronic disease. Among the best approach when a person is exposed to COVID-19 is to comply with their quarantine period. In addition, they must follow the instruction or advice of their doctor to prevent or cure COVID-19. Next, in the scope of the risk management in terms of the family, they must be obey all the instructions without leaving the house during the duration of the movement control order. In addition, the family should have a high level of honesty. This is because, for example, if family member has a fever, parents should immediately go to the clinic for a treatment. In most of case, they fail to come to the clinic for the treatment, and until will be a risk for the of being affected of the COVID-19. And lastly, as a parents must ensure or control their children to stay at home. If parents fail to handle this problem, COVID-19 could be more easily spread, and the family will be in a high risk. Therefore, as families, it is necessary to monitor and control and guide their children to avoid going out of their homes in order to reduce the COVID-19 infection. So that's all for my explanation.
Now I would like to present about my part, which is risk contacts. Risk contacts consists two, which are internal contacts and also external contacts. For internal contacts, our closest persons such as family members, friends and also colleagues, and it also may be our neighbors that are commonly our close contact in our daily life. If all of us do not practice the correct way in order to prevent COVID-19, it is not possible that COVID-19 can spread continuously among us. While for external contacts, we have to avoid gathering in crowded places such as assembly, big event or any occasions that involve many people. This is because we are exposing ourselves in public and it is not possible that one of the strangers are having COVID-19 symptoms. Next, I will continue with risk criteria. Every single person must take high responsibility and know the risk tolerance that they have to acquire during COVID-19, such as first, you have to always wear your mask wherever you go and do not forget to apply hand sanitizers together. And you have only going out if only necessary and you got something important to do. Next is contactless delivery for grocery shopping or other essentials. Before use all of those products that you bought, make sure to wipe them down and to end for extra cautious from the virus. And for nowadays, you have to only meet person only by online, and you can download any application such as Zoom, Skype, or you can even video call by WhatsApp. Next is social distance. One of the most important part to be practiced is at least make sure 20 feet from around your surrounding. And next, you have to be an obedient citizen and you must follow the rules that set by the government for your own health and also for your safety. Now I would like to talk about risk likelihood measurement. For risk, you have to for risk, those who have stayed together with the person who infected with COVID-19, the likelihood is high. And how to control the measure, you have to go for checkup and stay at home while waiting for the results. You have to quarantine yourself, and also you have to sanitize everything around the house or wherever that you have been when. And next is suspected case was working on site, and the likelihood is also high, where all employees must go for a checkup and stay home while waiting for the result, also need to quarantine, and the site must be closed and sanitized all over the building, and no one will be allowed to work. And next is general travel, including foreigner. The likelihood also high, and they have to check out and quarantine for 2 weeks, and they have to avoid crowded places. And next is poor hygiene. The likelihood is medium because you have to practice good hygiene, you have to follow all the guides as advised, and you have to wash hands with soaps regularly. Next is risk severity measurement. First is asthma, where the severity is high. The action to take is taking all asthma as medication as directed, and also you have to avoiding potential asthma triggers. And why is it high risk for asthma? It may affect respiratory tracts such as nose, throat, or your lungs. And for chronic lung disease, it is high also, and action to take for chronic lung disease is keeping the immune system strong, and also treatment and symptom management. And why is it high risk? It is because may lead to mild to severe respiratory problems. And for diabetes, the severity also high. The action to take is following all COVID-19 infection prevention recommendation, and you have to also check up with your own doctor. And why is it high risk? It could cause acute cardiac injury. And lastly, for senior citizen, the severity is also high, and the action to take is you have to follow up with doctor, avoid gathering in crowd or public places. And why is it high risk? It is because senior citizen may have underlying diseases. That's all from me. Thank you.
Risk identification is process of determining risks that could potentially prevent the program, enterprise, or investment from achieving its objective. According to WHO, World Health Organization, the most common symptoms of COVID-19 are fever, breakout, and tiredness. Other symptoms that are less common and may affect some patients include itches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, or a rash on skin. These symptoms are usually mild and begin gradually. There are also people who may be infected by COVID-19 but are not showing any symptom at all. Reason they are being infected might be because they have been in close contact with people with COVID-19 or had been to the country or even with people that have been infected with COVID-19. Therefore, if you have been in close contact with people being infected with COVID-19, it is better for you to quarantine yourself or do a checkup. Risk analysis is process of identifying and analyzing potential issues that could negatively impact key business initiative or projects. When calculating the mortality rate, we need to know the number of actual cases that have already have an outcome, whether it is positive or negative, recovery or death, not the current cases that still have to resolve. Mortality of COVID-19 are higher than influenza. As we can see, table 1.1 shows the graph of daily confirmed COVID-19 cases and deaths in Malaysia. From the graph above, we can see the number of daily confirmed deaths is lower than the number of daily confirmed cases in Malaysia since January 1, 2020 until May 18, 2020. From table 1.2 and 1.3 shows the current situation of COVID-19 in Malaysia. As a conclusion, based from the graph above, we can see that the severity of COVID-19 in Malaysia are lower rather than in other countries. This is because of the sacrifices made by Malaysia's frontliners as well as Malaysian people, and not to forget Malaysia Health Director General Datuk Dr. Nur Hisham Abdullah and Malaysia's Prime Minister Tan Sri Muhyiddin Yassin that plays an important role in fighting the COVID-19 cases.
Today, I will explain about the risk evaluation. Risk evaluation is basically a steps on how the industry or any sectors face the COVID-19. The sectors that our group choose is the tourism sector. There are 5 steps, which the first one is identifying existing and potential losses. The tourism sector will face significant financial difficulties as it fails to generate revenue or profit from customer. They must implementing urgent measure or plans to prevent the sector from being seriously affected by COVID-19 disease. Refund to customer, and because the tourism sectors need to return the money as there are tourists or customer already booking their tickets. The second step is evaluating potential risks. Travel agency will face losses may have hard time paying the employees. This will cause some travel agency to dismiss the employees as they are no longer able to afford them. Due to the lockdown in several countries, the currency of the country will also fail as a result of the closure of entrance and exits in the country during the pandemic. The third step is examine the alternative risk management technique. Ability to manage risks will not only affect the company's profitability, but it could also mean the difference between staying in business or not. For risk control, the tourism company need to find solution on how to alter the organization exposure to risk. For example, the tourism company can stop the operation of their company for a while since the world now are fighting with the COVID-19 virus. The fourth step is selecting and implementing the risk management program. In the financial criteria, we want to see whether it will affect the tourism industry profitability or any return. While the non-financial criteria are to see whether it affects the growth of the organization, humanitarian aspect and legal requirements. With this kind of situation that our tourism industry face, the profitability will be decreased because basically most of the profit is come from the customer, and when there is no customer, there will be no profit to gain. And the last step is evaluating, reviewing, and controlling risk management program. In order to make everything goes back to normal, the most important thing is people must follow all the ways on how to prevent the COVID-19. People must always clean their hands, maintain a safe distance, stay home if feeling unwell, and follow what have the government said. Therefore, government must enforce the law to control the number of cases. Next, I will continue explain about the risk treatment. The first part of risk treatment is reduce the likelihood of the COVID-19 infection. First, our Prime Minister Tan Sri Muhyiddin Yassin advised to all the people to remain resilient and continue obeying the Movement Control Order or MCO to help the country fight COVID-19. By staying at home, you can do many activities with your family during the MCO, and it will build your relationship with each other stronger than before. Next, people also were asked to avoid public gathering to avoid the infection. All gatherings such as international meetings, sports competition, social and religious events should be postponed or cancelled until we successfully break the chain of COVID-19. Third, cover mouth and nose with mask and make sure there are no gaps between your face and the mask. It is very advisable for those people who are sneezing to wear a mask, but if you are healthy, you need to wear a mask if you are taking care of a person with COVID-19. Fourth, wash hands with soap and water or alcohol-based hand sanitizer. This is because we do not know the things or people that we touch will not give any infection to us. Alcohol-based hand sanitizer may be used to those people who find it difficult to wash their hands regularly. And the last one is practice the social distance. And the last one is practice the social distancing. Social distancing can be defined as keeping space between yourself and other people outside of your home. Since people can spread the virus before they know they are sick, it is important to stay away from others even if they have no symptoms. The second part of risk treatment is reducing the severity if infected with COVID-19. There are several ways that people who are infected with COVID-19 can practice or apply to reduce the severity. The first thing that they can do is to immediately seek help from nearest hospital. If you have a fever or difficulty breathing, therefore you should call a doctor. By seeking medical care quickly, it can help reduce the risk of an infection becoming more serious. Second, assist government to trace contact history. Contact tracking is a little like detective work. Trained workers interview people who have been diagnosed with an infectious disease to find out who they may have in touch with recently. Once someone has been confirmed to be infected with the COVID-19, contact tracers attempt to track others who have recently had prolonged exposure to that person when they may have been infectious. Besides that, tell the truth about your COVID-19 contact and travel history to medical officer is also one way to reduce the severity. Be honest to the medical team so they can take any possible measure or action to avoid it become worse. This is because we do not know if we sat near to an infected individual on a plane or a bus. Lastly, take medication and treatment as prescribed by doctor. There is currently no recommended medication for treating COVID-19 and no cure is available. If you have mild symptoms, your doctor can suggest receiving treatments at home. He or she will give you specific instruction to control your symptoms and not spread the disease to others. But if you are very ill, you might need hospital treatment.
Now we move to monitoring and review. For the continuous monitoring of the risk treatment implementation, why we need to monitor COVID-19 cases? The first reason is to flatten the curve. As there is currently no vaccine or specific medication to treat COVID-19, and because testing is so limited in Malaysia, the only way to flatten the curve is through collective action. Next is to prevent big cluster to occur. As we all know in Malaysia, Sri Petaling Tabligh cluster is contributing half of the COVID-19 cases in Malaysia. The Malaysia government used the smartest way to trace them, which they will find the suspect patient by spreading the news throughout all the media, including using the short message service or SMS, in order to force them for taking a swab test. And lastly is to break the infection chain. To comply, Malaysia government have temporarily closed public schools and many businesses have advised employees to work from home. The government also advised that all events including religion gathering of people should be cancelled or postponed. Besides, the government also stipulates that only one person or family leader can go out and buy daily necessities. Travel in excess 1 kilometer will be banned and told to go home by the police roadblock. And now we review the effectiveness of risk management with recent development of COVID-19. By doing movement control order and enhanced movement control order in Malaysia, Malaysia can actually control the clusters. As we all know, the big cluster from Sri Petaling, which is Jemaah Tabligh, contribute half of the cases in Malaysia. But due to the commitment of the front lines and the Jemaah Tabligh itself, the patient under treatment now is 0. Furthermore, the case curve also been flattened today. For the time being, 22 May 2020, the recovered patient rate is 82.09% from only 1,163 total active cases. Next, Malaysia also has been recognized by the world for the success in control the COVID-19. For example, Director General of Kementerian Kesihatan Malaysia, Dr. Nur Hisham Abdullah, has been recognized as one of the top 3 best doctors in the world by the CGTN media in China. This is relating to his service in providing important information about COVID-19 and at the same time helping the community to remain calm on facing the pandemic issues. In addition, due to the competence and expertise of the Kementerian Kesihatan Malaysia in conducting COVID-19 screening tests in Malaysia, Malaysia also has been selected by WHO, which is World Health Organization, specifically Sungai Buloh Hospital, as a vaccine research center. Last but not least, the risk management by Malaysia is not only have a huge impact on the health, but it also have a huge impact on the people economy. The government come with better idea, the iconic package that can help people, and no one will left behind. Bantuan Prihatin Nasional, or BPN, is an economic stimulus package by the Malaysia government that leading any other Southeast Asia countries. Imagine that one household can earn to 8,000 ringgit. This package includes B40 and M40 groups, pensioners, single that income below than 2,000 ringgit, and even students. So no one will be economically affected. To sum up, we have a lot of things to be proud about Malaysia, and in handling this COVID-19 issue is one of them. We are too amazed about other countries' good things, but we always forget to appreciate our own greatness. Positive patient of COVID-19 in Malaysia is already declining, which shows that cooperation between us, all of us Malaysian, can curb the virus pandemic. Last message from us, many people ask what country gave for us, and now we ask ourselves what we are giving to the country. That's all from us. Thank you.